Jim Grimes, Liz has the evening off. Well, it's taken some time, but marijuana no longer has this negative stigma that it once did. More people recognizing its potential medical benefits and supporting its legalization. But there is still some unknowns, including a side effect that's gone mostly unreported until now. CBS 12's Katie Benty is joining us live tonight in West Palm Beach with what parents need to know. Katie.
That's right, Jim. It's called cannabinoid hyperemesis syndrome, or CHS, and this can cause some severe symptoms, including something called scomery. That is when you are vomiting and screaming from excruciating pain. But this can also lead to some other issues like malnutrition and dehydration. Now, I spoke with a local pediatrician today about what causes this condition and what parents can do to help keep their kids safe. It's a growing concern that could be affecting your child. A dangerous health condition linked to marijuana use is sending more teens to the ER with severe nausea, vomiting, and stomach pain.
I would say at least a couple times a month I'm seeing patients present with this, we call it intractable vomiting, and no one can figure out why, but they have no other symptoms.
Cannabinoid hyperemesis syndrome, or CHS, may sound like something you'd expect from a bad batch of marijuana. But according to Dr. Sara Tano, a local pediatric emergency medicine physician, CHS is actually a chemical reaction inside the body.
It causes the part of your brain that produces nausea to be hyperactive, and also the part of your brain and GI tract that cause severe pain, like visceral organ pain, to get overstimulated.
Dr. Tano sees it all too often. The symptoms can last for up to 5 days, and in some cases, patients report being stuck in a cycle of pain, vomiting, and hospital visits.
A lot of times they'll tell me like, oh, I went to this other hospital, I went here, I went there, and it's not getting better. And because sometimes the medication is enough, it's just time letting it kind of get out of your system.
Some patients have found temporary relief by taking a hot shower or bath. But for others, the symptoms are severe enough to require hospitalization and even IV medication.
Besides the medications that we have, they're quick fixes, but if you continue to smoke, you're going to have the same symptoms again.
Dr. Tano says it's a wake-up call for teens who smoke regularly and for parents who may not realize the risks. Dr. Tano says the key is really to just have open conversation with your kids. If you're noticing some of those symptoms, it might be time to ask some of those tough questions. Reporting live in West Palm Beach, I'm Katie Benty, CBS 12 News.
Well, it is the last